So there's lots of debate online about how President Trump handled the coronavirus. Now, most people have an opinion that President Trump did a good job handling the coronavirus in terms of his leadership, or he did a bad job, right? And you've seen the debate online and in the news, and that's the weeds. Did he do a good job? Did he do a bad job on coronavirus? Good job, bad job, good job, bad job. That can never be resolved because it's all just opinion-y stuff, very opinion-y. So what I did was I took it up to the high ground and I tweeted this. And this is the fun part for today. So I tweeted, the best example of unscientific thinking lately is that one can compare leadership across countries by looking at their coronavirus outcomes. That isn't even close to being a thing. So that's my high ground move. It is not scientific thinking to believe that you can compare how leaders did in this coronavirus situation from one country to another. If you think you can do that, or that it's so obvious you don't need Scott, it's so obvious, you don't need a controlled study. Just look at the graph. United States graph looks like this. South Korea looks like this. Duh. It's obvious. Just look at the outcomes. Different leadership, different outcomes. People who did similar kinds of things, good outcomes. Scott, duh. It's as obvious as it could be. Right? But it's not. You can't compare leaders across different countries. That's not a thing. Can't be done. There's no science in the world that can do that. The smartest scientists in the world could get together and try to study this, and they wouldn't even have the right data. They would just look at it and say, well, thanks for inviting us here, but we don't really have the kind of data that would be able to sort this out. Don't believe me yet? Let me run through some examples. So just this morning, so here's the big problem. You have different leaders, but they all have different countries. You're going to ask me later, but wait, what about some of the Scandinavian countries? They're similar-ish, right? We'll get to that. Hold that thought. I'm not forgetting it. We'll get to it. Number one, how many other countries have fake news like we have in the United States? I don't know. Do you know? How many countries have free markets and fake news? If I go to South Korea, will I see two different versions of the news? I don't actually know the answer to that question. Do any of you? If I go to South Korea and I'm flipping through the news channels, first of all, is there more than one? I don't even know. Do you? If I go to Sweden or some other country and I'm flipping through the channels, am I going to find an entire major news network that's just making stuff up? Because we have that. We have an entire major news network that literally is just making shit up. You don't believe that? You don't believe that our fake news literally just makes stuff up? Well, did you watch Meet the Press, in which Chuck Todd, after the Kayleigh McEnany quote had been completely debunked, where she had allegedly said that we wanted to send kids back to school even if the science said otherwise. But really, she said, we want to send kids back to school because the science says it's safe. Everybody knows that that's what she said. Everybody knows that the initial story was just grossly taken out of context to literally reverse its meaning from we want to be compatible with science to we're going to ignore science. Days have passed since that story came, was debunked, and went away. And even yesterday, NBC, Chuck Todd, brought that story out like it was true, as if it were true, days after it's been debunked on all the networks, except, I guess, his. So you don't think that he knew what he was doing? You don't think that Chuck Todd and all the people involved with that production, you don't think they knew that they just made something up out of nothing? Well, I used to think, well, maybe they're just confused. Maybe there's some cognitive dissonance going on. But this is one of those cases where you just can't believe that. You just look at it and you go, Chuck, I'm pretty sure Chuck Todd watches the news. I'm pretty sure he's noticed that even on CNN it got debunked. Even Jake Tapper debunked it on CNN. And he still did it as if it had never been debunked. There's no way that is anything but just intentionally putting on fake news. There's no way I can see it any other way. Now, is that the case in other stories? And why does that matter? Well, what did our news tell us? It told us that hydroxychloroquine will kill you. It told you that your president wanted to inject disinfectant or drink bleach or some damn thing. That wasn't true. So we have a fake news which has been completely discrediting our leadership in ways that are almost unbelievable. Do other countries have that same situation? Do they? Do they have that same situation? So if I went to South Korea, where they got a better result because their leadership was so good, do you think if I turn on the television, I'm going to get completely fake science? Maybe. I don't know. But I'll bet you don't know. So if you're comparing those countries, that's a really big variable in how well your leader could even get people to do things. How about face masks? Do you think that the United States would have had, let's say, better results if President Trump had been more aggressive about face masks early on? Maybe so, right? But what advice was he following? He was following medical advice that said face masks didn't work. Turns out that was a big old lie. Even Fauci now admits it. But wasn't it the World Health Organization, the Surgeon General, all these experts were telling us masks didn't work, and then they just reversed it and said they do work. What did that do to the population of this country? If you were a citizen in this country and you knew that your news was completely unreliable, they're clearly lying to you about big medical stuff. I mean, life and death stuff, they're just lying to you. And then they say masks don't work, and then they completely reverse it and say masks do work. If you were in South Korea, what did you make of that whole situation? If you were in South Korea, was there ever one moment when you, as a citizen of South Korea, were seriously considering that masks don't work? I'll bet not. I'll bet nobody I won't say nobody, but I'll bet the population of South Korea started out thinking masks work because there's more of a culture of wearing them routinely. And I think they stayed that way and they ended that way. Now, if they didn't have fake news and they didn't have medical experts lying to them, was that because their leader was so good? Was it because President Moon in South Korea was such a good leader? Or was it because they don't have a fake news and they don't have an anti-mask situation? They don't have this divide between the left and the right, where if the left says breathing is good, the right will say, well, we're not going to breathe then, and then they'll all die. Does that exist in South Korea? It's apples and oranges. Part of the argument of why leadership has made such a difference is you'll see the graph that says the United States curve looks like this, and here are these other countries in which their curve looks like this. And so based on the outcomes, one of them had better leadership. And so I'm looking at the graph and I'm saying, it's a two-dimensional graph. How did they put hydroxychloroquine use in there with all the leadership? They didn't. So hydroxychloroquine use, which you've seen other charts to show that they're highly correlated with the outcomes, right? Now, I don't know if those other charts are true or not. I can't trust anything at this point. But there's certainly indication that it's a major factor. And that's just ignored. Now, why is it that hydroxychloroquine would be so ignored in this country? Well, again, the fake news, right? As soon as it became sort of a Trump pill, do you think this country was going to use it as aggressively as other countries? No. And we also didn't have a supply. Do you know who did have a supply? Germany. Germany had a supply. because they have a company, Bayer, that makes it. So if your country had a supply of hydroxychloroquine and they used it, are we comparing leadership from one country to the other? Or are you comparing that one country had fake news and one didn't? Because if we didn't have fake news, and we did have a factory that made hydroxychloroquine, probably would have used it more. And maybe we have better results. How about TB vaccinations? Is that on your chart? When you're seeing how each of the leaders is doing based on the outcomes of their coronavirus curves, where on the chart do you see tuberculosis vaccinations? Because a new study just came out said that there's a very high correlation between the countries that routinely give these vaccinations and ones that don't. Because there's some thought that the vaccination that, I think it might be a combo vaccination, I don't know what it is, it's the BCG vaccination. But different countries have different policies about whether you universally get those or not. In the United States, it is not the policy to universally get this vaccination, apparently, because we don't have a problem, I guess, with tuberculosis or something. And it's a high correlation. If you don't have that vaccination, you have much worse problems. So where exactly on that chart of coronavirus do we see the vaccination information? You don't. And this study said that it found that the number of vaccinations of this type, the BCG, reduced the number of reported cases in the country. So would your leadership variable pick up the fact that your country doesn't have BCG vaccinations? No, that would not be picked up. Let me ask you this. If Obama had been president when the coronavirus kicked in, this should just make you laugh. I don't even have to finish it. Do you think Obama would have been better at getting Republicans to wear face masks? Raise your hand if you think that Obama would have been more successful in getting Republicans to wear face masks. No. No. Obama would be the worst choice for getting Republicans to wear face masks. Because the moment that Obama said wear a face mask, Republicans would start yelling, it's Sharia law, it's Sharia law. He's making us wear a scarf because the very next step is we're going to be a Muslim country. There isn't any way that Obama could have gotten more compliance from Republicans wearing face masks. Now, do I think that Trump has done a good job in getting people to wear face masks? No, I don't. I do not think he did a good job there. But I don't know that somebody else would have done a better job, if you know what I mean. There's something about the character of the American public that is not comparable to Sweden. Let me ask you this. When we compare ourselves to other countries, do you take into account the, let's say, the independence of the American voter and how varied and different we are? I mean, we are a melting pot, not just in ethnicity, but in political belief and every other kind of belief. We have the most diverse public you can imagine. Can you get a diverse public to all comply to anything? Sort of no. It's really hard. Can you get a public that is very uniform to agree to something? A lot easier. Do you think it's easier to get the Japanese public or the South Korean public to do something? The Swedish public? Probably. Although Sweden's a little more multicultural lately. So that's not a factor. Let me ask you this. If you just took one of these great leaders, let's say President Moon from South Korea, or Angela Merkel, who's being mentioned as a good leader in this regard, if you just took one of those leaders, and let's imagine that they spoke fluent English and they could run for president in the United States, could you just take that leader from that other country that did so well, put them in the United States, and they would also do well. What do you think? How in the world would you know? And if you don't know that, do you know anything? Because how are you comparing the U.S. leadership to any other leadership if you don't know the answer to this question? If I take one of the good leaders from the other country who got a good result and just pluck them into the United States, would they have gotten a better result? You don't know. Here's the other thing you don't know. In 2019, there was a stock picker, a financial manager, who had the best results of all the people who were professional stock pickers in 2019. Just was the best of the best. And we're talking about tens of thousands, hundreds of thousands of stock pickers. And one of them beat everybody else. So you should put your money in that one, right? If there was one stock picker who did pick better stocks last year, and this was the most recent year, so that's the most reliable, right? What's happened recently. And they killed all the other people. So you should put your money with that one, right? No. If you think that that's true, then you don't understand how to analyze anything. Somebody was going to be the number one stock picker of 2019. Somebody was going to be. Because lots of people were guessing, and somebody was going to guess better than other people. It was guaranteed that somebody would be at the top and somebody would be at the bottom, just because there were lots of people doing lots of different things. Some guessed right, some guessed wrong. The only thing you know, if you're looking at 1 year, which is what this whole coronavirus situation is, you're looking at, months really, not even a year. If you're looking at one point in time and you're looking at the result, you don't know anything. You don't know anything. You only know that in this fog of war, let me give you a better picture. There are 5 different wars that break out in different places at the same time. And in each of those cases, the country being attacked is in complete fog. And they don't even know which way the enemy is. Now, if you're being attacked and you're in complete fog and you don't know where the enemy is, you're still going to fire back. But you don't know where you're firing. So the people in Sweden said, I don't know where to fire, but I'll fire this way. Bang, 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 bang. Another country said, I don't know where the enemy is, but I'll fire this way. Bang, 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 bang. And one of them hits the enemy. One of them, just by complete luck, fired into the fog and hit the enemy. Are they the good leadership one? No. They're the ones who fired into the fog and got lucky. In the beginning of this coronavirus situation, all of our data was wrong. All of our assumptions were wrong. Pretty much everything we knew, we didn't really know. It was changing. The experts were disagreeing. What was the good leadership thing to do in that situation? Well, when it's all done, because we're dumb, we will look at who had the best result based on whatever metric we decide to look at, and we're going to say that one was the good leader. It won't be true. It won't even be close to true. It will be the leader who fired into the fog and got lucky. Because nobody knew what to do. If everybody knew what to do, you would have seen people doing largely the same stuff. And there was pretty big variation in what people did. Now, the other thing that people say is, Scott. You can look at Sweden, and you can see that they're having higher infections because they didn't do a full close down. It was more of a, just be smart sort of situation. Whereas similar Scandinavian countries, they didn't do what Sweden did, and they have lower infection. Therefore, they're the better leadership, right? Right? That's pretty clear, because the Scandinavian countries are somewhat comparable in a lot of ways, and one went one way and got a bad result, and everybody told them. Everybody told Sweden, hey, Sweden, we're all smart, you're not. So if you do that approach, you're going to have high infections, and that's not going to work out for you. And then Sweden went into it, and they got high infections, just like everybody said. Everybody told them you're going to get high infections if you do it the way you're doing it, and they did. So Sweden's the bad one, right? No. No. If you think you can conclude that, you don't know how to analyze stuff because it's only halftime. We're literally at the halftime of the game. You don't know how Sweden's going to turn out, do you? In your mind, have you said, "Oh, Sweden's making a mistake because we're all going to get to the end of the coronavirus at the same time, and when we get there, Sweden will have more deaths because on the day that it's all over, it'll all be over, and then we're all done, and we'll count up our deaths, and they'll just have more of them. So that's a bad job for Sweden, right?" No. We don't know that's what's going to happen. We don't know that there will be an effective vaccination. We don't know if there will be a number of vaccinations and some work better than others. We don't know when that's going to happen. And we don't know as much as we'd like to know about herd immunity. For example, it seems as some people have some kind of natural immunity. And there's some evidence that some people who have just been exposed to other coronaviruses might just not get it. Now, if it's true that exposure to other coronaviruses gives you a measure of protection, how many people need to get the coronavirus to reach herd immunity? You don't know, do you? Right. Here's the kick in the pants. If it's true that these other coronaviruses give you some protection against this coronavirus, it could be that herd immunity happens at closer to 20% infection because there's still, let's say, 40% of the public has that other coronavirus protection. And if you add the 40% that have this natural protection to the 20% who gained immunity by getting it, suddenly you're at 60% immunity. And if Sweden gets there first, did they lose? Or did they win? Because the way it's looking, everybody's going to get to about the same level of infection for whatever their country is going to ultimately get infected. Because we're not going to stop international travel. Do you think New Zealand is the smart one? Oh, New Zealand's pretty smart because they wiped it out on their island. Well, that's kind of easy if you're an island. Good luck New Zealand and good luck Hawaii and good luck Taiwan. They all came out pretty well, right? Because it's harder to get there by travel. So here's my bottom line in that. Sweden could, there's still a possibility, I'm not predicting this, I'm just saying that one of the outcomes is that Sweden will look like the smartest one when it's all done. Now, you're saying to yourself, every expert disagrees with that, Scott. Because they're doing so poorly in the middle of it, how in the world could they ever end up being the best one? And I just told you. We don't know, but if it turns out that part of the public is immune, Sweden is going to get to herd immunity first with an economy that's still relatively functional. That's not a bad result. So if you think you can compare, you can't. When you saw the graphs of which countries are doing better or worse on coronavirus, where was the variable of vitamin D? Where was that on the chart? Do all the countries have the same amount of vitamin D? Do all the citizens have the same amount? That's a pretty big variable, we think. All right. So if you don't know about vitamin D, you don't know about hydroxychloroquine, you don't know about the differences in how states have power in the United States, because we don't have a dictator. The states have to have their say. The governors were very involved. If you don't know that, you don't know about herd immunity, you just can't compare leaders. You just can't. So I would say that the only thing we can measure right now in the United States is if our hospitals still have capacity. The only thing that seems like a reliable indicator to me is that you kept your hospital and your healthcare system open. So I would say that if we get to the end of this, every country that kept their healthcare systems alive did well. And every country that did not, if they lost their healthcare system to the point where other people were dying because they just couldn't get healthcare, then I would say those are failures. But short of that, I don't know if there's any other measure that's going to be as useful as you think for sussing out who the good leaders are.